So you may be a great candidate for filler if you've experienced any volume loss in the face. Now, what does volume loss even look like, right? It's when you notice that you have shadows in places that you didn't have shadows before. So basically, if you have nasolabial fold shadows, tear trough shadows, marionette shadows with a jowl, any areas where you've noticed that the light has kind of shifted on the face. So as we age, the lights that we have when we're younger, when we're youthful, where the light hits us really well on the cheek, really well in the center lower of the chin, and on the tip of the nose, those lights can actually change over time, and you can experience volume depletion in the deep fat pads of the face, and that can shift this one nice beautiful light here and beautiful light here into one light in between this nasolabial fold pad, and then two shadows right here, the nasolabial fold shadow and the tear trough shadow. So these are indications for treatment. Also, as we age, unfortunately, the lip, which was a wonderful, beautiful grape when we're young, turns into a little bit of a deflated raisin. So we need to revolumize the lip and bring a little bit of that bouncy youthfulness back into the lip so it doesn't look deflated. Now, this can range anywhere from taking the lip from deflated and kind of wrinkly look to making it just look plump, a little bit more plump, a little bit more smooth, to actually making the lip a bit bigger. So this is where consultation actually comes into play. Do you actually want the look of the lip to be larger? Would you like the ratios changed, the upper to lower lip to be a little bit different? These are things that are discussed during your consultation. There are very few true contraindications to filler treatments, and these can definitely be discussed during your consultation. There are 3 different variations of fillers. There's Sculptra, which is actually a biostimulator that stimulates the growth of collagen in the skin. There's Radiesse, which is calcium hydroxyapatite, and it is another biostimulator that stimulates collagen and elastin in the skin. Then there's traditional HA filler. This is what most people know as dermal fillers. These are the Juvederm family of products, Restylane, as well as in Europe it's called Teoxane, here it's RHA, and Versa. The main concern that I hear from patients when they come in to receive dermal filler treatments is concerns of looking puffy or round or fake or migration. I hear that one a lot. So the best ways that we can avoid this is, again, that consultation piece. It's listening to you and finding out exactly what you want. Are you looking for a more cut jawline? Are you looking to really get rid of your under eye bags, that you had? You're trying to hide the fact that you have no sleep in a 6-month-old at home, right? So we want to hear you out. We want to hear exactly what you're looking for, your concerns, and then we pick the precise product that's going to be able to deliver that, and technique pattern. One of the biggest concerns that I hear from patients is, will it hurt? And we totally understand that. That's why here we pride ourselves on having very gentle hands, the strongest numbing cream, Pronox, which is half laughing gas, half oxygen to really take the edge off, fuzzy blankets, and your own personal tapper to distract you from what's going on. After you've received your treatment, it's important to continue to apply ice and take Tylenol to decrease discomfort afterwards. Your own patient concierge is going to be texting you that night to check in on you, make sure you're doing great, and answer any questions that you might have. As far as healing and downtime goes, it is a needle entering into the skin, so please understand that you might have some bruising, discomfort, and some swelling, but this will get better. Especially if you've had lip filler, the swelling can be intense that night and the next morning. It's okay, it will go down, and you will love your results. I always say, don't love or hate your filler for 2 weeks. You want to make sure that everything has fully settled, the filler has integrated into the tissue before we really judge the final results. The maintenance for your dermal filler treatment will depend on the area that was treated and the product that was used. It can range anywhere from 6 to 18 months depending on these factors, and your provider will go over a maintenance treatment plan for you so you know when you should come back, so that way you can maintain your results long term.